call our next guest doctors, the dynamic mother-daughter duo, and ultimately teachers, because every time they visit us, we learn something new on how oral health can fundamentally impact your child's overall health. Doctors Lynda and Krystle thanks so much for joining us again, ladies.
Thank you.
So much good information always comes from our conversations, and I want to definitely focus on how this experience has you making the connections between the mouth and overall health. Because I think that's something that our audience always wants to know more about. Like, I didn't know the mouth could be the source for so many different things. How did you all venture into this?
Well, I mean, you know, you heard Dr. Lynda's story, but it has been many years of passion, curiosity, and seeing how the research is now starting to link itself and connect. And this is research from pulmonology, pediatric sleep, pediatric ENT. So all of that, and then obviously pediatric dentistry and facial growth and development. So all of that is just now coming together at the right time, along with the clinical experience of many years, decades of clinical experience.
Yeah.
So it just makes more sense to approach dentistry in this way.
A wealth of experience on this couch, and I'm always lucky and blessed to share space with you all. I want to talk about the initial exam, because I feel like everything is very personalized to each child. So with the initial exam, you know who you're dealing with, but where do you move forward from that? Because we saw Grace's initial exam, and she's coming back for her follow-up.
Yes.
How do you have that individualized care plan?
Well, first we're looking as a whole body and trying to make sure that we're making the connection for that child, looking for what function do they need to make sure that their faces grow the best. And like we said in previous segments, how well your face grows determines how well you breathe and how well you sleep. And all of those are really important for a growing child. So generally after that exam, depending on what that child needs, that's how we plan the next segment. It could be like in the case of an infant, it could be the non-surgical light laser treatment, or just getting them to be back on the breast efficiently, or it could get to being able to release the ties themselves surgically, or if it's in the case of a toddler, it could be the growth guidance, like helping their jaws to grow the best. Or if they have a cavity, unfortunately, then it could be getting laser fillings done.
Amazing. And then what I love is that you all focus on non-invasive and different ways to do procedures. So talk a little bit about the procedures that you all do at the children's dentistry.
So laser dentistry is a huge part of our practice, and part of the main reason is because lasers, even for taking out decay, focus on the decay. So you're not taking a lot of tooth structure out, and you're also, for the majority of our patients, you're not having to numb. Right, which is Novocaine, getting Novocaine local anesthetic. You're not having to do that, so it's a comfortable experience. You get to do more work, and which lessens the amount of visits parents have to use. And then in the case of surgeries, better healing time, just a very clean-cut surgery in and of itself, and very precise. And then on top of that, then you have the non-surgical aspect as well, which you have like the pain relief, the increased blood flow, increase, you know, the neurology, waking up because you're able to, you know, penetrate deeply without any pain or anything like that. So there's a lot of different things, and then along with our different tools for growth guidance, you know, different appliances that we're able to use on top of that, and then therapy, meaning like myofunctional therapy, things like that, that also allows like the whole treatment plan to kind of come together and have a child be treated in a very comprehensive way. It's amazing.
It's amazing. And like I said, every time I talk to you all, I realize that it's making the dental experience for children less scary overall. What's the one thing you wish most parents knew that you always have to myth bust when they come in?
Well, I think that for a lot of them, when they hear that mouth is open, they don't really realize that they're really supposed to be breathing through their nose. And so when we say that, they're like, well, doesn't everybody have to breathe through their mouth?
Look, I had to just think about it right now. Like, okay, got it.
But no, it really isn't. And the other one is that the tongue is attached all the way to the tip of our toes. And because it's having to coordinate a whole lot of the body function, and they go, that's something that they never knew about either.
Amazing. Like I said, amazing knowledge. It's like I call you all professor, teacher, doctor, all of the above. Ladies, thank you so much again. And then for our audience, if you have any questions for the doctors, ask them at dcnewsnow.com/growinghealthyfaces. You can get your answers right here on Live on Air.